I have worked in emergency medicine for over 30 years, and there is a statistic that keeps me up at night. Nearly half of all heart attack deaths occur before the patient ever reaches the hospital. And for people over 60, the odds of survival drop significantly if you are home alone when it happens. This isn't meant to scare you, it is meant to prepare you. The reason so many people don't make it is simply that they waste time. They panic, they hesitate, or they mistake a heart attack for indigestion until the golden window for survival has slammed shut. But the good news is that there are specific, science-backed actions you can take in those first few terrifying minutes that can double your chances of survival. These are the steps cardiologists wish every patient knew. Today, I'm going to walk you through the exact survival protocol you need to follow if you ever find yourself clutching your chest with no one around to help. Number 7, call emergency services immediately. Do not call your son, do not call your neighbor, do not drive yourself to the hospital. You must call 911 or your local emergency number the second you suspect something is wrong. In the medical world, we have a saying, time is muscle. Every minute that blood flow is blocked, more heart tissue dies permanently. The American Heart Association data shows that patients who call for help within the first 10 minutes have a 50% higher survival rate than those who wait. Yet, tragically, nearly 1/3 of seniors wait more than 2 hours before making that call. They worry about bothering people or feeling embarrassed if it turns out to be just heartburn. You need to change that mindset right now. If you feel crushing pressure, a cold sweat, or sudden breathlessness, treat it as a heart attack until a doctor tells you otherwise. Better to be embarrassed in an ambulance than dead in your living room. Make the call. Once that call is made, you need to initiate chemical warfare against the clot in your chest. Now, let's move to number 6. Chew an aspirin. This is not for pain relief. This is for blood flow. Most heart attacks are caused by a blood clot blocking an artery. Aspirin is a powerful antiplatelet drug that stops that clot from getting bigger. But you cannot just swallow it whole with water. You must chew it. Swallowing a pill takes 10 to 12 minutes for your stomach to break it down. Chewing it delivers the medicine into your bloodstream through the lining of your mouth in seconds. A landmark study in The Lancet showed that immediate aspirin use reduced mortality by 23%. The protocol is simple. Take 1 full-strength, 325 milligram uncoated aspirin and chew it until it is a paste, then swallow. If you are allergic to aspirin or on blood thinners, skip this step. For everyone else, keep a bottle of aspirin in your nightstand. It is the cheapest life insurance you can buy. While the aspirin starts working, you need to physically prepare your body to endure the stress. Number 5, loosen tight clothing and sit upright. Panic will make you want to lie down or curl up in a ball. Do not do this. When you lie flat, gravity spreads the fluid in your body across your lungs, making it harder to breathe. It increases the pressure on your heart. Instead, sit on the floor or sturdy chair. Lean back slightly, supporting yourself with pillows or against a wall. This is called the tripod position, or semi-Fowler's position. It maximizes the space in your chest cavity, allowing your lungs to expand fully and reducing the workload on your heart. At the same time, loosen your belt, unbutton your collar, and remove any restrictive clothing. You want zero resistance to your blood flow. A review in the European Heart Journal confirmed that upright positioning significantly reduces pulmonary congestion, that terrifying feeling of drowning that often accompanies heart failure. Give your heart room to work. Now let's move to number 4, cough CPR. I want to be very clear. This is not a substitute for medical care. But if you are alone and you feel the room spinning, your vision narrowing, or a wave of blackness coming over you, this technique can buy you seconds. The technique is to take a deep breath and cough forcefully, deep from the diaphragm, every 2 to 3 seconds. The mechanism here is pressure. A forceful cough increases the pressure inside your chest cavity, which can mechanically squeeze the heart and force a small amount of blood up to the brain. In cardiac labs, patients undergoing arrhythmias have been kept conscious for minutes simply by coughing on command. If you feel like you are about to pass out before the ambulance arrives, cough hard and keep coughing until the dizziness passes or help arrives. It acts as a manual pump for your failing engine. While you're stabilizing yourself, you need to ensure the paramedics can actually get to you. Number 3, unlock your door. This is the step almost everyone forgets in the chaos. If you collapse behind a locked door, paramedics have to waste precious minutes breaking it down. Those minutes could cost you your life. After you call 911 and before you sit down to rest, unlock your front door. If you can, prop it open. Then, sit near the door if possible. Also, keep your phone in your hand or right next to you. Do not leave it on the counter. If your condition worsens, you may need to call back or answer the dispatcher. A 73-year-old widower in Arizona survived because he unlocked his door before collapsing in his hallway. Paramedics walked right in and started CPR immediately. Had the door been locked, the outcome would have been tragic. Remove the barriers between you and your rescuers. Now that you have done the physical prep, you must master the mental game. Number 2, controlled diaphragmatic breathing. Your body's natural reaction to a heart attack is to flood your system with adrenaline. This triggers the fight or flight response, causing your heart to beat faster and harder. But right now, a fast heartbeat is the last thing you want. You need to slow the engine down. You do this with your breath. Focus on inhaling slowly through your nose for a count of 4, allowing your belly to rise, not your chest. Then exhale slowly through pursed lips, like you are blowing out a candle, for a count of 8. This type of breathing stimulates the vagus nerve, which acts as a brake pedal for your heart rate. It signals your nervous system to calm down. Research in cardiopulmonary rehabilitation shows that controlled breathing improves oxygen saturation and lowers blood pressure during cardiac events. Do not gasp. Do not hyperventilate. Breathe slow, breathe deep, and tell your body to hold on. And finally, the most difficult but most important rule of survival. Number 1, stay absolutely still. Once you have unlocked the door, chewed your aspirin, and positioned yourself upright, you must stop moving. Do not try to pack a bag for the hospital. Do not try to feed the dog. Do not pace around the room. Every time you move a muscle, your muscles demand oxygen. Your heart has to pump harder to deliver that oxygen. But right now, your heart is in crisis. It cannot afford to waste energy on your legs or arms. It needs every drop of oxygen for itself. Stay as still as a statue. Close your eyes. Focus entirely on your slow breathing. A study in the European Heart Journal found that minimizing physical exertion during acute coronary episodes significantly reduced complications. Your job is done. You have summoned help. Now your only job is to conserve energy until they arrive. Surviving a heart attack alone is terrifying, but it is manageable if you have a plan. To recap, call 911 immediately. Chew a full-strength aspirin. Unlock your door. Loosen your clothes and sit upright. Cough only if you feel faint. Breathe slowly and stay absolutely still. These 7 steps create a bridge that carries you from the moment the pain starts to the moment the paramedics walk through your door. Memorize this protocol. Write it down and put it on your fridge, and give yourself the fighting chance you deserve. And if you liked this video, please don't forget to subscribe to our channel as we continue to bring you more life-saving information. Thank you, and we will see you next time.